Positive cases are decreasing across much of the country, and some governors are now announcing plans to roll back the mask mandates in schools. Daryl Forges has the details.
Some good news. New COVID-19 cases continue going in the right direction. According to data from Johns Hopkins University, the country is seeing a 7-day average of nearly 292,000 new cases per day. That's a 43% decrease from a week ago. And the Department of Health and Human Services reports hospitalizations are down 19%.
Because of the dramatic decline in our COVID numbers, effective Monday, March 7th, the statewide school mask mandate will be lifted.
With positive COVID numbers decreasing, governors in Delaware and New Jersey are announcing plans to roll back school mask mandates.
We are not removing the ability of individual district leaders to maintain and enforce such a policy within their schools, or any private child care provider from maintaining such a policy within their business should community conditions require.
Some health experts say this is the right move.
Yes, it may be the right thing to do at this point. We need to look community by community to see what the numbers are like.
This as a bipartisan group of governors are pushing the White House to issue guidelines to help the country move beyond the pandemic.
I think what governors are sensing is that we need to agree upon a set of metrics when we're going to start to roll back these mitigation steps and give people a light at the end of the tunnel. What is that point when this stuff gets turned off?
I'm Daryl Forges reporting.
You know, it's good to see things moving in the right direction, finally. Even though we had to drag some folks kicking and screaming, and some are still trying to push us back. Go deeper into the pandemic, please. We're not done yet. We've been dealing with so much, let alone death, illness. It's just horrific. You know, you saw the movie star and singer Tyrese talking about, can he get prayers for his mother, who he loves dearly, because she's contracted COVID and is in the ICU, and she has some other health challenges. But I don't want to go backwards. So, you know, there's not that much left of the school year, Mike. And we're not just talking about southern states, Delaware, New Jersey. I would like to just keep the mask on. And frankly, when you fly to and from Atlanta or wherever else you're gallivanting all over the world with your celebrity friends, I want you to wear a mask when you fly. I don't know that that's that much of a sacrifice after what we've been through.
Yeah, you're right. I mean, we have been here before, right? So it seems like we take these steps forward. We're thinking, okay, it's over or it's close to being over. And then all of a sudden a new variant comes out and all of a sudden it sweeps the nation again. And it seems like we go right back to square one. I don't see how it hurts to keep the mask mandates on. I understand people want to get back to a sense of normalcy, but what is the new sense of normalcy here in this country? I think, once again, we're always going to be living with the coronavirus, COVID-19, in some way, form, fashion, or another, just like we live with the flu now. It's just going to be under control and not putting people in hospitals and putting people in morgues. So I think there's nothing wrong with keeping it around, especially in schools, especially for travel, especially for indoor dining for right now, or indoor facilities, I should say, for dining. I know a lot of this is political, and that's the problem. The whole pandemic has become so political that, you know, oh, let's just give them some kind of bone. Let's give them something to think about, something to smile about. We want to see their smiles yet again. But we have to be cautious. I think it's better to be overly cautious than to allow us to go back out there and have to deal with this all over again. And look, I'm just going to leave it up to the scientists and leave it up to the politicians. And hopefully this time, once we take the mask off, we can actually keep them off. But there's nothing wrong with keeping it on. And then there's nothing wrong, Sharon, with if you choose to and your family chooses to, keep your mask on. Just because they don't have a mask mandate doesn't mean that you can't put your mask on. It's not saying that you shouldn't put your mask on. You might get a couple of crazy looks from a lot of crazy people out there anyway, but it's up to you to keep your health intact.
Yeah, and I think, and I saw this, and it's controversial, so I hate to even repeat it, but I do believe it's true, where a doctor, a very reputable doctor, said, listen, we've underestimated, yes, we want everyone to wear a mask, but we've underestimated the valuable tool of one-way masking. Like you said, you can still keep your mask on. And nobody can force you to take it off, okay? If you want to get a tattoo, if you want to get your ears pierced, if you want to, you know, put on a mask, you can do that. And so I hope that you do that. And it sounds like you're saying you will also talk to all of your celebrity friends out there and convince them to do the same. Sounds like you've agreed to that. Yeah. And that's really all I'm looking for.
I will say this. I will say this. I think it's important. There are certain environments that I will wear my mask, and then there are certain environments where I feel, I don't know, and I shouldn't feel this way, and this is wrong, where I feel comfortable keeping my mask on. When I go to the gym, if I'm not around anybody, I'll take my mask. I know it's wrong. I know it's wrong. But I'm being honest. I'm being very transparent.
Breakthrough cases.
Yeah. But
well,
and then I'm like, and then sometimes we feel like there's. Oh no, Cynthia's worse than me. You don't talk to Cynthia.
Oh,
Cynthia, by the way,
and
is
I
kind
find her to be perfect.
In her own quarantine. Yeah, she's in her own little quarantine right now in the Big Brother house, so she doesn't worry about anybody being around her. Yeah,
that's
so
right.
when she gets out, then maybe we'll put a little bit more on that. Yeah. But yeah, I think it's you know we have to be the example, like you said, because if not, then people will use us as the example the other way. But I've had it.
Yeah.
I think I've had it twice. I think I had it even before we knew what the coronavirus was. I had it back in July. Double vax, boosted. Can't wait to get another boost just in case. So I think I
can't wait.
Everything in my body that's kind of fighting it off. But I can also tell, Sharon, when I'm around somebody who has it because I feel my body fighting it off. I really do. I can always tell if I have been exposed to the coronavirus. I can. I can.
Well,
then. No lie.
I'm not going to argue with you about what you're feeling, but I am going to say this. If indeed that's the case, we have got to, and I would say, well, we've got to wrap you in something head to toe. One of those white science suits where they go in. They were fighting Ebola and they put on these whole things. And I think they've got, well, they've got to study you, because if you can tell just by the way your muscles lock up and whatever, there's a battle going on inside your body. Well, then we've got to get you shipped to the CDC immediately if you trust that they will. We just need to bottle it, is what I'm saying. If that's all it takes.
Get my blood.
And what do you do? Do you run the other way, or what do you do?
No, I load up on, I take more elderberry, I take more sea moss, and then I just fight it off. I try and fight, but I feel my body fighting it off. It's like a cold. But here's another thing, Sharon. Another thing mask does? Mask also keeps you away from the common cold and the flu and other germs that may be out there as well. So there's nothing wrong with that. Long before we saw about the coronavirus, anytime you went to the airport and you saw a group of Asian people walking through the airport, what were they wearing? They were wearing masks
because,
a long time
over in parts. They've been doing that a long time. But you're right. I love a mask, but it also protects you from other people's bad breath. Okay? So that can continue in some corners, and who we're talking about, okay? I love that. You're a close talker too.
No, you can still,
come on
the
now.
problem is,
come on.
If you got that N95 mask on, your breath better be good too, because you can smell if yours is kicking.
All right.